So when I first got sick, I had really mild symptoms. I kind of felt like I had a head cold or a sinus infection, a little bit of fatigue, congestion, headache, and diarrhea. I actually didn't have a fever until I'd been sick for several weeks. So just because you don't have a fever doesn't mean that you don't have COVID. Like I said, I had mild symptoms. I got tested the first time on day 6 after I had symptoms. The CDC usually recommends getting tested anywhere from day 5 to day 7. So we tested on day 6, and that test was negative. But I knew I didn't feel good. I knew I was sick, so I continued to isolate. And we retested on day 8, and then I was positive. By day 10, I started to feel really bad. Like I had terrible fatigue, cough, sore throat like I've never had before. I started getting random episodes of shortness of breath, and I had diarrhea, chest pain, nerve pain, earache, loss of taste and smell. Basically, every symptom that you've heard that could be COVID, I had. And these symptoms just kept getting worse and worse. So most people start feeling better at least by day 14. I think less than 10 days is the most common statistic, but by day 14, most people feel better, and I didn't. On day 17, I went to the emergency room, and I had fever. My pupils were uneven, which made me afraid that I could be having a stroke, and I had dehydration. They also diagnosed me then with COVID sore eyes, which was not a symptom I had heard of before, but my eyes hurt basically, and that's a new thing that they've discovered can happen when you have COVID. And so I got some fluids and they sent me home. And then a few days later, I had just been getting worse and worse and worse. I had fever, I think my highest fever was like 104.7. It wasn't coming down with any medicine. I started getting to where I couldn't breathe at all, like just walking a few feet. My oxygen level would drop way down, and I felt terrible. So ended up going to the hospital, thank goodness. My oxygen level, normally your oxygen level is supposed to be in the upper 90s, but mine had dropped in the low 70s. And so went to the emergency room, and that's when they diagnosed me with acute respiratory failure and bilateral pneumonia caused by COVID. So I was in the hospital for 3 days. I was on oxygen, I got IV steroids, I had 2 units of the convalescent plasma, and I was on blood thinners because COVID increases your risk of having a blood clot, which could cause a heart attack, a stroke, or a PE. So after 3 days, got to go home, was very thankful because being in the hospital anytime is not fun, but this was the first time I'd been in the hospital for a long time, and because I had COVID and all of the restrictions, I was there by myself. Very little contact with anybody. Like the nurses came in all gowned up and everything like they're supposed to and took great care of me, and thankfully I was able to use technology and use my phone and talk to my family and friends, but it made me really feel bad for the people that can't do that because it would be a very isolating thing. So that was about day 23. Went home, I started to get a little bit better at this point, but on day 30 I still had fatigue, was short of breath. They sent me home from the hospital on oxygen that I was wearing all the time, and got a little bit better day by day. On day 37, we were finally able to come out of quarantine. So we still didn't really leave the house, but it was nice to know that we could if we wanted to. And all in all, I was off work total for 4 weeks, and I was out of the office for 6 weeks. Thankfully, I got to come back and work from home for a week while I was regaining my strength. But now I still have some lingering effects from COVID, which has been difficult, but overall I would do anything to prevent from that happening again. For me, I think the scariest part is that I'm a medical professional, I'm a nurse practitioner, and so I know when to tell people you should seek help and go to the emergency room. But when I was so sick, I was completely out of it and didn't realize I needed to go to the hospital. Like, if it wasn't for the people in my life that were like, hey, we need to take you to the hospital now, I very well could have ended up not here. The emergency room doctor had told me that if I had waited a few more hours, my outcome would have not been the same. Like, I definitely would have ended up on the ventilator, and could have very well died. And so to me, it's terrifying to realize that I was that close to dying, and knowing if I had lived alone and not had somebody there with me, I very well could have. So I think looking back, that's the scariest part. At the time, I was so sick, I didn't even realize that I was that sick, so I wasn't scared then. But yeah, it's really scary that it's all happened like this. And the lasting effects have been kind of scary, because I was not expecting to have issues after I got better. So now, even being almost 6 weeks out from my actual active infection, I still have heart issues, shortness of breath. I'm still wearing oxygen at night, dizziness. The COVID sore eyes affected my eyesight, and I had to get new glasses and start wearing glasses all the time, as to where before I only wore them when I needed them. So it's kind of scary that COVID can really, really affect everything, even weeks and months later. I am going to take the vaccine as soon as I'm able to. I wish that I could have taken it sooner. And if going forward, if there's anybody that's questioning it, I would highly recommend getting it. I have to wait 90 days because when I was in the hospital, I got the convalescent plasma, which is plasma that people who have had COVID donate to try to help build your antibodies when you're sick. And so since I had that, I have to wait a few months, but once I am able, I'm going to get it as soon as I can. Everything that I went through and I'm still going through it's been a lot. And so if there's any way that I can help prevent other people from experiencing and going through what I've gone through, or your family members going through it, I want to encourage you to do that. And I want to say too that I know that we've all heard things about the vaccine and things about people getting sick after you get the vaccine, and not feeling good and stuff like that. But usually if you do have symptoms after the vaccine, most people only have them for a few days. 1 or 2 days, you don't feel good, but then you feel better. And then you're protected from this terrible virus, as to where I had symptoms for 37 days. So 1 or 2 days versus 6 weeks, it's absolutely worth it. And if you're hesitant, do your research. Go online and look at reputable websites that end in .gov or .org. Look at reputable sources, do your own research, and make your own opinion. Talk to your doctor, talk to your PCP, because they are going to be a wealth of information for you. And overall, get the vaccine, wash your hands, wear your mask, and do your part so we can get back to normal life as soon as possible.